right, everyone, let's get started. Hello, and welcome to the webinar, The Importance of Digital Literacy and Its Impact on Understanding Health Information. Before we get started, I'd like to cover a few housekeeping items. First, we'll be using the chat feature for questions and comments. When you utilize the chat function, please make sure everyone is selected. For the sake of time, we are going to give our presentation first, and then we have dedicated 10 to 15 minutes at the end for questions and answers. So throw your questions in the chat, we'll collect those and then go through them at the end of the presentation. This session is being live captioned and will be recorded, and a captioned recording will be made available on our NNLM YouTube page for future access. Within 7 days, you should receive an email with the link to that recording plus the slides that you see today. And throughout this presentation, there'll be a variety of resources and engagement activities shown, and we'll provide links to those as well. So let me introduce our main presenter for the day. Our presenter today is Caitlin Moet, a health communications specialist from Wisconsin Health Literacy. Caitlin holds a bachelor's degree in marketing from the University of Wisconsin-La Crosse and resides in the Madison area with her family. She has over 8 years of experience in nonprofit organizations, including work in health literacy, healthcare communications, and community relations. She is known for expertise in health literacy, having initiated a county health literacy collaborative and managing multiple grant-funded projects throughout the state of Wisconsin on topics such as safe opioid use, health insurance, dementia care, and digital health literacy. So thank you so much, Caitlin, for joining us, and take it away.
All right, thanks, Brittany, and good afternoon, everyone from snowy Wisconsin. We're getting quite the snow down here. We are going to begin today's presentation, just jump right into the thick of things. We have quite a bit of materials to cover when we talk about technology, as you can probably assume. So as Brittany said, we are talking about the importance of digital health literacy and its impact on understanding health information. A little bit about our organization, Wisconsin Health Literacy. If you're not familiar, we are a statewide nonprofit organization offering education and training on health literacy. We do many community projects. My role primarily consists of going out to a variety of communities throughout the state of Wisconsin and hosting these grant-funded programs. Like you see in the photographs here, we are on your screen showing the top left is our pain medicines workshop, and in the middle is myself there working with a senior at the senior center and doing the online program. And in the bottom there is at a senior meal site where we've done another medicines workshop. We also host a summit, health literacy summit, every other year and have a national presence in many health literacy initiatives. Today's discussion, we're going to talk about the importance of digital health literacy, introduce the Health Online program in which we develop the curriculum, establish the program, and are facilitating throughout Wisconsin libraries. You'll see a snapshot there of the materials, the iPad and the handouts on the screen. We'll go overview of digital literacy strategies, and then Brittany will get back on and talk about the All of Us research program. So I'm going to start you off with a quiz, and feel free to put this in your chat. I do have my chat box open so I can read some of the comments. Which of the following is the single strongest predictor of an individual's health status? If you would like to comment on that, I'll give you a couple seconds to get your thoughts on what you think is the single strongest predictor of individual's health status. Great, we're getting a lot of good feedback on a variety of different, I see some on education, income, we're all over the board here. So it's quite not known, but I'm here to tell you today that it is, let's see if it's gonna, literacy skills. So those who selected 3, and given our topic today, it makes sense to talk more about our literacy skills. So what is health literacy itself? There are many different specific examples out there of what it could be, but we are referencing the Affordable Care Act of 2010, and it states the degree to which an individual has the capacity to obtain, communicate, process, and understand basic health information and services to make appropriate health decisions. That last part there is really important, is to be able to make those appropriate healthcare decisions. When we look at research, it shows about 4 of 10 American adults and 6 of 10 seniors have low health literacy. So this really puts them at a higher risk for higher rates of hospital admissions, emergency room visits, as well as poorer health outcomes. And here's a video I want to show you just to give you a better understanding. This will give a good overview. It's from the American Medical Association on health literacy. Some of you may have seen it. If not, this is always a good eye-opener for individuals who have not on understanding health literacy.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
I can't read this. Well, I guess doctor gave it to me, so it's okay for me to take it.
When your children have fever, what do you usually give them?
Motrin or Tylenol. Normally Motrin, because that's what my doctor recommended.
How old is your daughter?
She is 4.
She's 4. Okay.
I would give her the 4 to 5, a tablespoon and a half.
One capsule.
That's right. One capsule.
One capsule. I don't know this is. Twice daily.
Okay. So how would you take this?
When I see it's not on, I tell you how to take it. It say take it twice daily, but it don't say what time to take it.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension, and I've been taking care of that for a long time.
Hypered? Hypered?
Like you're hyper? What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
It being, you know.
Okay. But you know you have high blood pressure. Okay, but hypertension doesn't mean the same to you. So if I ask you if you have hypertension, you're going to just think, I think you're jumping around on a chair or something like that, something different.
Just being hypered, you know.
Okay. All right. Well, I haven't done a very good job teaching you what hypertension is, because I think you take that medicine for your hypertension, and that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension, to us, is the same thing.
The same thing.
Yeah.
I have a small breakfast, and then I take my pills. I usually take 16 every morning. Sometimes it's difficult to for me to take these pills because if they say 1 tablet twice daily, I don't know if they're talking take 1 in the morning, 1 in the evening, or take 1 in the afternoon or 1 in the evening. So usually what I do is take 2 of them in the morning. Then this way I know I have them.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. And I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, "How are you feeling since your hysterectomy?" Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body and I didn't know it?
So I think that covers a lot, and I think there can be a lot of emotions and feedback from that video and describing what health literacy can mean to many individuals. And it's really that you cannot assume that you understand everyone's literacy level just by looks. I mean, we had master craftsman, deacon, worldwide traveler, director, and they're in all at different reading levels, and many below the 6th grade reading level. So that is one approach to take, is just you cannot assume these literacy levels that individuals have, both coming into your library and as a patient thinking about health information. So now I want you to think about that and navigating health information online. You know, these are a lot of printed materials people are getting, talking with doctors, and then trying to figure out all the information they have to consume and understand online can be a whole nother process. So another question, I'll be looking at the chats. I want you to think about, what do you do when you want to find ways to get healthy? When your child has a rash, when your mother starts to show signs of dementia, when you want to find the best health insurance, if you want to use the chat feature, just give me some ideas. What are the things that you would do? And it doesn't have to be online, but just think about what would be your first reaction if this were to come about. Web search Medline Plus, great. Ask a friend, okay. CDC, Google it, great. So there's a lot of feedback on there between PubMed, Ask People, Google, Call a Doctor. So we're getting a lot of feedback. Really, searching online has become the new norm. It's kind of had a term now of calling it Dr. Google, as Google and searching online has become the #1 thing to do when looking for health information. And just to look at statistics alone, 81% of U.S. adults use the internet, and this is from a 2003 Pew Research study, so you can only imagine that number has increased since that 6 years ago. 59% of U.S. adults look up health information specifically online. So really, you know, there is still that ask a friend and ask a doctor, but really today, it's not really ask your neighbor back porch conversation. It's more looking for advice, information, and conversation online. And our hearsay is really becoming what we hear and do online. Even health professionals themselves are using online resources. For an example, I went to go visit a friend who just had twins, and the nurse had asked, "Are these identical twins?" And my friend said, "Yeah, that's what the doctor said." She's like, "Well, I'm not too sure." And what do you think the nurse did? Well, she turned around and she went and Googled identical twins right there in front of the patient. So that was just an example of it being used within practice itself. So the amount of health information is increasing online. And this is huge when we think about health information and the way that it impacts a person's health care. 50% of health searches have an impact on that person's health care. And I think we even think this is true outside of healthcare. Think about, you know, this webinar, the last conference that you were at, presentations, materials, and connecting. It's all online. Today, more and more people are expected to take more action, a more active role in their healthcare themselves. Having that patient-centered care is what they're labeling it. Having access to health information on health portals. So that 50% of health searches, that's a big number, and important for them to understand the information they're looking up and how it's having an impact on their decision-making. Unfortunately, though, there is this digital divide that isn't really spoken about among seniors and those with low health literacy. 15% of adults with below basic health literacy, so, you know, they're not able to navigate the hospitals. They're really only able to look at an appointment slip and circle the time that they're supposed to go for an appointment. They're not able to look at health insurance information and figure out what their bill means. So that is only about 15% of that population is looking online for health information, while 62% with proficient health literacy, so 62% are able to, the proficient health literacy, you know, they're able to read the prescription labels. If you think back to that video, the difficulty, those were all with the below basic health literacy levels. And we're not talking about those people, but 62% of those adults are looking online for health information. So this is a big digital divide that you're seeing between the two perspectives and health literacy levels. Again, that those with the lower health literacy, they're having difficulty finding reliable health information online. How do they know what sources are credible? They're having a hard time navigating a web page, reading a web page. Where do they begin? A lot of times it can be just very intimidating looking at that web page and having that eye tracking. And then we talk about accessing the internet. Do they have internet connection? Do they know where to go to the library to access the internet? So these are all things to take in consideration when you think about those with the lower health literacy. Oops, I skipped a slide. I did want to ask a question here first. Again, in the chat box, if you would like to use, who here owns a smartphone? And I'm talking smartphone where you use digital data. Yes, I do. I do. All right, we're getting a lot. A lot on there are using. Well, skip to the slide before, so in case you saw it, the number is large. When we talk about 2019 data from Pew Research, they reported that 81% of us own a smartphone in the US. 74% own a desktop laptop computer, 52% own a tablet. So this is a big population that has access to online information. There was a research done out there trying to collect if there's more cell phones versus toothbrushes used. You might have heard that there are more cell phones than toothbrushes used. This is not 100% accurate. But if you are interested in that research, that more people own a cell phone. There are over 7 billion people in the world, an estimated 3.7 billion own a mobile phone, or around 3.5 billion own toothbrushes, and this is from a Consumer Technology Association. But like I said, we know that as of February 2019, 81% do own a smartphone. And this has really helped us form a program where we call Health Online, Finding Information You Can Trust, taking in consideration that digital divide and seeing how many people are out there using these online resources to help those with this lower health literacy have access to reliable health information. So the Wisconsin Health Literacy, through a grant through the National Networks of Libraries of Medicine, Greater Midwest Region, we put together the Health Online, Finding Information You Can Trust. The goal of this program is to help consumers, especially from vulnerable populations and those at risk for low health literacy, identify and effectively use trustworthy sources of online health information. Now we are in the second phase of the program. We have been doing this program for about 2 years now and learning lots. So I'm going to walk you through our objectives. I'll walk you through the online program itself, and then at the end I'll tell you some report findings from our first phase of the program, and there's just the numbers out there to help us continue with this second phase of the program. So our objectives for the first phase is to conduct 32 consumer workshops in Wisconsin for seniors and other low health literacy and vulnerable populations. It was our objective to increase at 20% of participants' stated confidence to access trustworthy health information online, as well as to have a 20% increase in naming the criteria for evaluating a website. And also we did 4 library train the trainer workshops to help the librarians feel comfortable helping patients find reliable health information and sustaining the workshops themselves. During the workshop, we do hand out some materials for them to reference, and plus, although it is an online workshop, the participants really like to have those take-home materials. Again, we are working with low health literacy, so some of them are still intimidated or have not used technology before, so they like these online or these printed materials to use as a reference. So here we have this is a lot of the information that you'll see online in a little bit with websites that we recommend. You will see on some of the websites that we list are specific to the Wisconsin population, and this can be adjusted in your own state. to have your online, the Badger link that you see there, .dpi.wi.gov, is an online library for Wisconsin residents. So I encourage you to adjust that to your online library for your state. And then that your Medicaid, and if you have the patient partnerships, which I'll go into detail, is about patient advocate resource for those that have trouble, questions about the healthcare system itself. So those would be 3 of them that you'd want to alter specific to your state. And here's a checklist that we use in the program. This was adapted from the National Libraries of Medicine checklist. And it's a good resource and helps us during the program itself to have the participants look at websites and ask these questions, checking for credibility. Again, I'll go into detail a little bit more when we look at our online program. Here are notes page handouts, and between the 2 of these here, I'll just go back and forth. You'll see that there's a section for taking notes. This was really important. We did a focus group with the program before it rolled out, and they wanted handouts where they could take their own notes alongside of what was the already materials that they were learning. So the notes already listed on this page is what is on the website, and then they have the lines to take their own notes. What you'll see is the website at the bottom here is for the online program, which you can access at any time. wihealthliteracy.wixsite.com/health online, where my mouse is at the bottom. This is the online program that we're going to be looking at that you can access at any time. Okay, so we're going to jump into the online program part now. This is a 90-minute workshop. I will say that we try to flex this between 90 minutes to a 2-hour program that we are doing at libraries, senior centers. I've done some also at English language learning classes at technical colleges or literacy agencies. So we've really worked with a diverse group of people. Hands-on learning, they're getting the iPads. As you can see, this is at a Deer Park library, hence the antlers and horns hanging up on the wall. This is a library in Wisconsin. And they get the resources to take home, which I just showed you. And we also did a pre and post survey, which helped us analyze and reach our objectives in studying that. So we're asking them about their confidence level and looking up health information, what resources they would use. So that is done in a pre and post survey. So let's go and look for the online program. So what you see on your screen now is the Health Online, Finding Information You Can Trust. This website is a Wix site. It was free for our program to create, and we are updating it on a regular basis. As you can imagine, technology is always updating and websites are updating. So we'll go step by step. We talk about our objectives for the program here at the beginning. And searching for health information that can be trusted. We're going to be looking at how to read a web page, finding quick facts and key points, how to tell if the information is from a good source, finding websites in other languages, very important, especially for, we have a high Spanish speaking population. I've done workshops in Hmong, Chinese. We have translated materials in these for the handouts for them to reference. Differences between using a computer and mobile device, local places to use the internet, and then some other online resources for health we discussed in the online program.
Hi, Caitlin. Sorry to interrupt. I think, are you looking at the website now? Because we're still looking at the PowerPoint.
Oh, yep. Thank you. That's because of the screen sharing. Let me get onto that. Okay. Can everyone see the website now?
Yes. Thank you.
Okay, thank you. I apologize about that. So I was just talking, here's the website from the Wix. So these at the top here are the objectives that we cover with the class before we start the program. And then in the orange here, it's very important to make this statement. And I think too, when you're talking about this criteria with any patrons in the library, of just putting that disclaimer, the information found on the website does not replace that of advice of a medical professional. Let them know that you are not a medical professional and that you're not here to diagnose, but to help them get the best resources for health information that you know of and they can find. Again, this is important. You need to reach your audience and see what levels they are on for technology. Is this their first time using the computer, the iPad, or are they more advanced learners? Talk about a URL. What is that? This is what the web address is, right? So we go up here in the top. This is our URL. Search bars, let them know how to use the search bars. Some of them, especially using an iPad, they don't know to click on the search bar itself to start entering the text. The browser. Do they know what a browser is and what a browser does? Because a little bit later we'll be talking about a privacy setting in a browser. So it's important for them to know that, okay, here we're using Google Chrome. The difference in that and an Apple product, you're not going to see that Google Chrome on your iPhone. You're probably going to see Safari. Domains, how important are domains at the end of the URL? We'll talk about these a little bit later, but just know that domain is the .coms, .edu, .org, and .gov. Social media, I've referenced this up in the top section, but this is something not covered in the workshop. This itself can be its own course covering on social media and finding health information. Just let people know, really use your gut feeling, best judgment. Always ask a health professional if it's something they're looking for treatment. And a good connection, if they want to connect on Facebook or Twitter, is to connect with their local hospital or healthcare clinic or library for health information. You know, again, scrolling, these might seem very basic to some, but participants, they need to know how do you scroll on a screen if it's touch-based or if you need to use a mouse or a laptop. Spam. The spam here is, okay, let them know that the pop-up's coming, not to click on everything, to check. And spam and email as well. Make sure that they know not to get their email out to everybody. And then a hyperlink. Okay, it's a link to click on for more information, and we're going to talk about how important it is to check for credibility on that hyperlink in the workshop itself, and not just to click on everything you see. So how can using these online resources be helpful? Well, having these mobile devices, especially in tablets, can really find information quickly right at your fingertips, literally. And getting this information, you know, you walk out of the doctor's office and you've just been diagnosed and you want to learn something more, well, there you go. You can learn it on your mobile device. You can check your health symptoms, research diseases, and communicate with your doctor. The health portals has become a very popular instrument in talking with doctors and nurses, getting prescriptions filled, getting appointments done, looking for wellness tips. This can be recipes, finding exercises, gyms, get all those wellness tips. Also tracking your health conditions, and this is for maybe more the advanced learners and having the wearables and connecting with their mobile devices. And of course, there's much more that can be done. Okay, searching for health information. Different search tools. So we go to the basics talking about what are Google and Bing. These are search engines. Okay, we're gonna show them what this looks like, Google, and again, entering when I have a fever and a headache, I can start to type in that information, and already suggested diagnoses, or not diagnoses, sorry, symptoms come up in that search field, so they can click on those. Bing is a similar one. Search bars on websites. So how search bars are different on a website than if it were in your Google. The search bars on a website, so for example, if I go to Wisconsin Literacy, if I search here, it's only going to be specific to my web page. So health information, it's only going to be specific to Wisconsin Literacy and not the whole World Wide Web. You see here, I'm only getting 471 compared to if I were to get it on Google. Okay, I have a billion over, a lot of information here. So let them know that that search bar does not search the World Wide Web. Then we have these privacy tools. DuckDuckGo. DuckDuckGo is privacy simplified. They state it right there, very upfront about what their browser does, their search engine does. And here we can look up health information again. And this limits tracking. So if you see here in the upper right, blocks advertising trackers, keeps the search history private, and it takes control of personal data. And this is really important when people are talking about their health information, maybe a diagnosis, maybe paying bills, maybe looking up other hospitals or doctors to go see, and they don't want others to know about it. This is a good search engine to use. Important though to note that this is within the tab itself. If you want to make the whole browser private, then you need to look into doing an private browser such as Google Chrome Incognito browser. To do this, if you follow my mouse up to the top right, you'll see 3 dots. You see new tab, new window, and then new incognito window, okay? If I click that, I want to share my screen here again. You should all see a black window. It says you've gone incognito. Does everyone see that? All right. Yes, great, wonderful. Now I can go back to my original screen. So those are some differences. That was the privacy browser. You also can do that with an Apple device. You want to look on, when you open a new window, there's double boxes on the right side, and you will see that there's a where that says private, and you just click on that, and it'll put into a private browser as well for Apple products. And then we talk about tips for doing a search, because this is really important. As you can see from that one Google search, you can get billions of search results from one search. So how do we help narrow that down? Well, we want to list multiple symptoms, right? So how I did that fever, headache, going into here, headache, cough, listing those multiple symptoms rather than just doing fever, search, headache, search. You'll get a very more concrete, narrowed down search results. Using a full disease name, right, instead of having the kind of like limiting abbreviations. Those two are quite similar. But if a doctor says, you know, it sounds like you have irritable bowel syndrome, instead of putting IBS, because you know, there could be an IBS break store, an IBS law firm or something, and then Google doesn't always know you're talking about health. Try to spell it out as best as possible. If you don't know that acronym, you can always just write IBS medical. So for example, you look on my screen, IBS medical. You look, okay, and now I'm getting irritable bowel syndrome. So that's an example to help you narrow down your search. Be gender specific for obvious reasons, different anatomy, body parts. So a woman having cramping and abdominal pain, and might be different for a male. So if we can help narrow down those search results. And again, age specific. A fever for a baby is going to be a lot more different than a fever for an adult. Let's narrow down those searches. I'll try to slow down a little bit. Sorry about that. Trying a search. So now that we have gone into showing a search engine, again, back at the Google here, we want them to think about a scenario that they can try a search themselves. So think about, you know, you just saw a doctor about your symptoms. They told you it sounds like you have an upper respiratory infection. You were given papers before you leave called an after visit summary. And then you want to learn more about your diagnosis. So you read your after visit summary and you see the following words: upper respiratory infection, cold, URI. And what the doctor, you know, had been explaining is these all three are the same. But if we were to be doing this search using a search engine for the words listed above, let's see what differences we get in doing a search for these three terms. So I'm going to do that up here. Again, I'm using Google. So I have my tabs on the top. If I click a new tab, I can do that. That will open up Google search. And then I can do upper respiratory infection. Now, do you see how I clicked on here, but it went up to my search bar? Upper respiratory infection, it already comes up because I have searched this quite a bit. Let me look at that. All right, so I get upper respiratory tract symptoms. It's in my title. It's in my verbiage here that you're seeing. Upper respiratory infection. Okay, so I'm getting a lot of results specific to upper respiratory infection. Starting to see the word cold, All right. So a lot there. Now what if I were to go back and my other one was cold? So let's compare that to cold. All right. Well, we got upper respiratory tract infection here, really not in the title. A viral infection, so we're losing upper respiratory, we got it here. But do you see how the differences in just that word in Google is making a difference in our search? Still not the same information. And now let's see what happens when we look up URI. The University of Rhode Island. So this is why I mean it's important to talk about not using abbreviations, or not spelling out the full disease name, URI, and then if we could put medical though next to it, upper respiratory infection medical. Okay. So there, just having that one word medical next to it, I get a great deal of good information compared to just that URI. I'm going to close out of some windows here. And I see there's some comments about the level of information being presented and how, yes, there will be a lot more. There's going to be an online learning, which we'll talk about more at the end, going into even more detail about the program. Given today's, we usually do about a 3.5-hour training for this program. So we are condensing it into an hour and a half. So stay tuned for more details coming on that. But I hope you can follow along with us still. So we did that search, and it's just important for the participants to be able to do that search themselves and get a good feel on what they're searching in the search engine. So if maybe some prefer to use the websites compared to using a search engine, we have some different websites that we've recommended working with doctors, pharmacists, other health professionals, as well as a medical librarian from the University of Wisconsin. We put together a list, and the National Networks of Libraries of Medicine, I should say as well, looked at this list and put together some basic consumer health information, less technical terminology. These are good starting points. I'm not going to go into detail on all of these websites. I just want to talk about them and what they are. So we have Medline Plus. This is one we really focus on during the workshop. All around a great resource, easy to use, easy to look at and understand. This is the home page. When you've looked at maybe some other websites, you could have scrolled for a long time, and this is just pretty clean cut, easy to use. And even you see here on the bottom, they have easy to read materials already created. They have organization directory, health information, multiple languages, a great resource. All right, and they also have this website. You see this Espanol, the Spanish. It translates the whole website directly into Spanish, which is an awesome feature. So that's Medline Plus. I encourage you to check it out, do some research, really dive into it on different health topics, drugs and supplements, videos and tools. I know the National Networks of Libraries of Medicine, they have trainings on going more in depth to this website if you're interested in that. The CDC.gov. Now you'll see I have a specific link for heart disease materials for patients. That's because the CDC has materials for patients and materials for professionals. It's important if you're working with, patrons or patients that you help them navigate the materials for patients and not that for professionals. And this is going to be more of your health facts. World Health Statistics is on the CDC, which stands for the Centers of Disease Control and Prevention. It is a government website. Then we have Mayo Clinic. Again, patient care and health information you'll see attached to this link because they have patient care and health information, and then they also have information for health professionals. If you're not familiar, Mayo Clinic is a world-renowned healthcare facility, health system with hospitals, a lot of them throughout the Midwest here, primarily in Minnesota, some in the western side of Wisconsin, and then other locations now throughout the United States, but they are a great resource with very reliable health information. FamilyDoctor.org. This is going to be online, just like Medline Plus. I'll show you this. It just has a different feel to it, more like I would think of a commercial website. The structure and having boxes and the way that it's outlined, having a little bit more for homepage. But this is through the American Academy of Family Physicians. So it's a group of doctors with the association putting together the materials, reviewing the information, and you know it's reliable. We have healthcare.gov. Many of you may have had questions with the open enrollment. This is to get health insurance through the marketplace. And then we have webmd.com and healthline.com. I like to talk about these two together as they're both .com websites. People ask, are these reliable information? I feel like sometimes when I read these, I feel like I have the worst diagnosis. You do have to maybe do a little more sifting through. The information is reviewed by medical professionals on the website, so they are credible resources. WebMD and Healthline do have a great symptom checker tool that you can use and put in your symptoms. So it's called right up here, check your symptoms. And then it goes through your specifics. So again, this is a commercial website. You'll see a lot more advertising on here though. It's just really user preference. And then for those living in Wisconsin, I mentioned this on the handouts. These are the websites that we direct people to during our workshop. If you would like to be more specific about your state, I highly encourage that. This is BadgerLink is the online library for Wisconsin. Then we have our DHS Wisconsin.gov Medicaid. So this is the Department of Health Services, and it's just nice how it breaks it into different age category or based on the participant, their status. And then we have the patient partnerships, and this is the one about the more legal advice or those for patient advocacy and helping empower patients in the healthcare system. And that is in Wisconsin. So that's a great resource. We do have different tiers of information. This is more for advanced information for medical professionals. We do list them on the website here just to let people, we don't go into detail during the program, but just to let people on their own time see the differences in terminology. And if they were ever to come across these websites to know, okay, this is probably a bit more information, not what I'm looking for, patient information. And some of them you even have to pay for, you know, if you're the American Medical Journal and want to look at the journals. Okay, what about Wikipedia? As people ask, this can be an okay source, but if you know about Wikipedia, this is information that can be edited at any time. It's an online encyclopedia, right? A lot of information in many different languages. Sometimes can just be neat to research what is out there, but it's a good idea to double check with one of the online resources listed above as another resource to verify the information you found is true. There are some websites to search for recommendations. So this gets into, I don't know if you've used Yelp before or if you've used maybe the Google star rating system. But just like that, healthcare is out there trying to do a consumer rating system on the healthcare services. So you can find doctors or hospitals. Healthgrades.com is a healthcare rating system where you can find a doctor or hospital. It gives you background on their education, maybe on the hospital, if there's been any quality concerns, safety concerns. They go through all that on the website. Care.com, we don't have no financial affiliation, but they do charge, there's a fee associated with using their website to find caregiver, childcare, home cleaning services. And then Medline Plus, again, another valuable resource that they have is their directories page. I'm wondering if it's letting me, maybe I'll try going to here, that link wasn't working. This directories page lets you get more specific into the different categories. So you want to see a specialist. I want to find a doctor and a cancer doctor, a dermatologist, a hand surgeon, you name it. Medline Plus has done a great job of breaking down the different categories for you to find those recommendations. Again, a sleep center, a free clinic, information, where to donate blood. So a lot of good resources out there. I'm going to clear out some pages here. Back to our program. Now let's get into how to read a web page. This is scanning for information to find information more quickly, what you're looking for, instead of having to read the whole web page to then be like, oh, well, that information had nothing to do with what I was looking for. So scanning tips. This might seem basic to some, but for others, this might be their first time reading a web page. Okay, so start with the bigger, bolder word. If I were to come to this web page and it says, I'm trying to line it up here, how to read a web page. Okay, I know that from this web page, I will learn how to read a web page. Okay, I'm reading left to right using the left toolbar and top menu bars. So we'll pretend these are my toolbars here, scanning tips. So this is where I go to find scanning tips or when scanning search results. Important information to think about. Read the content before clicking on a hyperlink. What does that mean? Well, that means, let me go up to a hyperlink here and you'll see, you see how my mouse goes into a hand position. On the bottom left corner of the web page, you will see the URL to the hyperlink, which is medlineplus.gov/directories.html. So that's a good thing to verify, especially if you have pop-ups that come on a window, or if you're just filling out a form and you want to know, is that form really linked to this website? Check on the bottom left of the web page and you will see that what the URL is. So check that content and before clicking on the hyperlinks. Scanning search results. Some people are like, well, I'll just click the first result because that's the most popular. Well, that's not always the best decision because it could be an advertisement or it could be that it just was the one that people always hit because it's the first one, which made it rank the highest. So it's important to do the scans through the search results to find. And if you don't find what you're looking for, to start over. Don't continue to add words in the search box because it's not going to help you narrow down your search. How to tell if information is good or harmful. This is a good point, good time to look at that handout that I referenced earlier in the PowerPoint. That checklist from the National Libraries of Medicine to check for credibility. Those are good questions on there. I'll reference them again here in a little bit, but credibility is proof that information is reliable. So we're looking at the About Us section of the site, looking for unbiased research, checking the bottom of the webpage for dates, sponsors, credit, and other differences. Okay, other details. So domain differences, .com, most likely owned by a commercial business. .gov, government-owned website. So you know that if it ends in a .gov, it is a government website. .org is most likely owned by a nonprofit organization. .edu is going to be owned by a school or university. So those are some of the things you can keep in mind when looking at the content of the page, is to consider the domain and where's the source, where is it coming from. In the website itself, it's great to have them do a little website comparison to check for credibility. So we can look at health.com compared to Medline Plus. I'm going to look at Medline Plus first because we've already been on that website. So again, I'm looking at the About Us page. So if I were to find the About Us page, oh, it's right here at the top, About Medline Plus. I can click on that and see that there is a great deal of information. Medline Plus is a online health information resource for patients and their families and friends. It's a service of the National Libraries of Medicine. So it's giving me some brief overview of what it is, but then I can get really into more information. Learn about Medline Plus. Okay, so I'm not going to go into great detail about that, but information for developers, using Medline Plus policies. So they give a good amount of resources here. Now let's go back to health.com. I'm looking for the About Us page on health.com. Now, I don't see it on the top. And this page usually takes a while to load. It's a .com, so again, it's going to be heavily condensed with advertisements. Okay, we got an iStock. I'm looking for the About Us to figure out what I can learn more about health.com. I would think it would just be a good health information website. Well, I'm going to help you out and skip all the way to the bottom because that's where the About Us is. You'll see that this website, though, it's still loading. All the stuff is not on here. There's a lot of subscribe links. Oh, there's About Us. And when I click on this About Us, about health.com. So looking at who they are, they, clear jargon-free language, it puts health into context in people's lives through medical content, insight from experts. Now, this is a key word here, experts. Why? Well, anyone can claim that they're an expert, but are they really a health professional? Do they have the medical degrees? Are they a doctor, nurse, anesthesiologist, whoever may be writing about the article? Or are they just experts who think they are experts? I'm getting a lot of pop-ups already. No, thank you. It's produced by editors and journalists. They say they have medically accredited sources listed below. When I scroll down, I don't see medically accredited sources listed. Then it goes into their content. But I do see that it has hundreds of doctors, experts, patients, and advocates have been interviewed during the production of our original content. So that doesn't mean that it's the final content that's shared on the website. So these are some of the things that you need to look for when looking at new websites. Okay, we already got another pop-up, so I'm just going to get off that website. So we looked at the About Us page. I think we could tell a lot from the two. Health.com is a magazine. Credible things to look for. So we have medical providers writing articles about topics in their practice. Contact information. Is it there, straightforward? Let's look at the bottom of the web page. I'm going to get out of this pop-up. Contact information. They have a contact us here. Well, they have a 1-800 number. 1-800 number. So that's how you connect with them. Let's look at Medline Plus. Let's look at the bottom of the web page. Well, right here, we don't even have to click into a Contact Us page. They have their physical address that they're giving. Okay, so we know who they're affiliated with. And if not, we can do connect with them. They also have an email link. And so they have the information in here to connect with them. Now let's get back into content. Okay, clear, straightforward information, does not hide any information. Content reviewed by medical professional. So this was the difference than that of an expert. Evidence-based, based on credible research and findings. If you start to read information that's based on I think, I feel, we believe, okay, those are some red flags. We want concrete evidence-based research. And do they share a privacy policy? Be cautious of certain brand names or products being credited. They may be trying to sell you something. Content reviewed by medical experts. Be cautious of that. And then opinion-based, like I just had mentioned before. I think, we believe, be careful of those opinion-based. And then here are those questions exactly from the handout. To ask yourself, who is providing the information? Why did they create the website? Again, you can use that handout, that checklist, to look at familydoctor.org and walk through with them to answer those questions together. Moving on to websites with multiple languages. I showed you how Medline Plus, they automatically, looking back into the main page, have the Spanish translation. But they also have health information in multiple languages, over 48 different languages here. They provide PDFs of health information and a variety of health topics. And then Medicare as well provides information in other languages. Differences between using a computer and a mobile device. Well, here, the biggest thing is that they're looking to do research. sit down and use a computer. It's going to be a lot easier than doing the scrolling and or the tablet and phone-based. Actually, some of the stuff from the mobile devices, the text can be taken out if read on a mobile device because they need to work with a smaller screen space, so it's not always identical to what you might be seeing on a computer. Local places to use the internet. This is the time to promote yourself. You're there, you're a library, you're there to help them. Hospitals sometimes have computers patients can use, county health departments, community centers or senior centers, schools. But again, think about that percentage, 81% have smartphones. You know, the other percentages were quite high for desktops, computers, and mobile devices. So even if maybe they already do, but they don't have Wi-Fi or data on their smartphone. So where can they visit? Can they visit a local cafe or business that offers free Wi-Fi? Let them know about that. And then other online resources, if you'd like to tell them about the health portals, the best thing to do if you want to tell them about the health portals is to connect them with their doctor's office to have them sign up. The health portals, if you're not familiar, MyChart is the one that we use here in Wisconsin through the UW Health Program. And it provides after visit summaries, medications, communications with providers, prescription requests, health news. It's really just a wealth of information that's specific to the patient, but then again, it has that health news that they can look back and see what the hospital itself is providing on different health topics. Engage with your audience if you want to tell them about wearables and tracking health vitals, as well as apps and other online mobile resources. There are also e-health newsletters and printable newsletters. NIH through Medline Plus provides those. And that is the end of the online program. So again, that's a lot of information there. We are going to be working on doing a step-by-step online curriculum with the script to put along with that, so stay tuned. I think Brittany will share more details at the end. And let's get back into the PowerPoint. Share my screen. So then we did the Train the Trainer session in addition to the community-based workshop, a lot of it from what you just had heard here. But this is a 3 to 3.5 hour program. We learned that 1 in 3 public librarians were unfamiliar with information resources for health-related questions. This was reported in a 2017 Pro Literacy blog. Resource for low health literacy learners, this is what they want to learn about. So we were doing this throughout the library systems in Wisconsin. Based off of the program that I told you about and some of the focuses groups that we've done, we are learning that through the adult literacy programs in Wisconsin that are through our member agencies, they want to find health information on symptoms, resources to stay healthy and in other languages. They want help scanning websites for relevancy. During a 20-person focus group done at the University of Wisconsin Family Medicine practice, age ranging 24 to 82-year-old, the younger population preferred the MyChart or the health portal, it'd be more common term, general term, and then searching out their symptoms, like in Google or Bing, using those search engines. The older population preferred to have that face-to-face interaction going to urgent care or their primary care physician. If we asked what most used websites they visited, was Mayo Clinic, WebMD, and Google search. Then based off the pre and post surveys, the results that we had from our audience, which I wanted to give you a little more overview, the program reached several diverse populations. 180 participants identified being 55 years or older, 53 identified having low literacy, and 75 identified being English language learner. The project reached 17 different ethnicities in 22 Wisconsin counties. And there is a larger report of the first phase of this program on our website, which I can share at the end in the chat. But from the 282 community-based workshop participants, after the workshop, there was over 40% increase in identifying reliable websites, over a 30% increase in using the evaluation technique, so using that checklist to find credible websites, and just over 37% increase in feeling very confident for finding good health information online. So that was well above our 20% goal that we had when starting the program. Some digital literacy strategies I wanted to review with you. Just adopt universal precautions. The gloves of the, you'll see pictured there, so think about like nurses or doctors that visit with patients. They put on gloves. Why? Well, they wanted to just not assume that they're going to be safe, and if any bloodborne pathogens are out there, they don't want to be exposed to. So they just put gloves on to be cautious with all patients and adapt universal precautions, and don't assume that you're not at risk. Slow down when you're working with the digital literacy program and those with low health literacy, English language learners, seniors, those that maybe have never used the computer before. Get to know what their learning level is and start from there. Use TeachBack. TeachBack, we talk about in health literacy as being a way, well, in the doctor's office, you were just told this is the best exercise for you to help with your current condition. The doctor would say, tell me what are 3 strategies, 3 things I told you to do when you go home, to make sure that the patient understood what the doctor was talking about in their own words. So that's using TeachBack, and this can be applied to any practice, any profession, really when you're doing a training and teaching somebody, okay, now with this online program, tell me what are 3 good websites to use to look for reliable health information? Or tell me what is one thing to search for credibility on a website? Instead of having that open-ended question, do you have any questions? Because that really leaves it for a yes-no answer and not to see what their understanding was. Practice plain, simple language. Again, some statistics, 20% of adults living in the US read at or below a 5th grade level. Most healthcare materials are written at a 10th grade level. From personal experience, I used to work at a hospital, and I did a lot of the online materials and brochures. And I used the readability tools available out there, and I found that the materials I was creating was at 11th and 12th grade level. This was before I got into health literacy, and I was just amazed. I thought I was using pretty plain language to find that I needed to step back quite a bit. And it's more and more healthcare systems are taking these measures to update their materials and be more applicable with the 4th and 5th grade reading levels. And also, if you want to compare it to something, most newspapers are written at a 6th grade level. So that's kind of a good comparison to think about. Here's a question on usability testing. I wanted to get your guess on looking at the 2 left and right screens. Now, this is called eye tracking. Which one do you think is a user with low literacy? Do you think it'd be the left screen or the right screen? And you can use the chat box if you would like. I'll give it a couple seconds. Thinking about everything that we talked about, yes, I'm seeing a lot of comments on the right, okay, left. Well, good, thank you for your participation. The correct answer is the right screen. And that from this study done, and it's from healthonline.gov, they did this eye tracking. It's because those with low literacy, well, they don't know where to start. So their eyes may be going all over the page. They're not sure how to use the left toolbar, starting with the big bold words. And then they're rereading words, trying to make sense of that, trying to comprehend, okay, what did I just learn on this web page? So that's where you see a lot of dots going back and forth, where the one on the left is going to be more smooth, more less time spent on that page with a higher literacy level. And then accessing the internet. Again, not to assume that everyone has access to the internet. but I read something through the Health Affairs 2016 publication that you may be aware of, but libraries and librarians contribute two particular strengths to advance a culture of health. That's accessibility and trustworthiness. And I think when we think about health online information, that's two big things that we're focusing on, is accessibility and trustworthiness in the information. So letting them know that you are a place to access the internet, maybe combined with a Technology 101 class for new users. Try to think outside the box and how you can connect with them. Just know that you're a very valuable resource. And then also about the free Wi-Fi in communities I had touched previously on in the online program, but this is something to keep in mind. Let them know where they can use their smartphones if they don't have those data plans, that they can get free Wi-Fi. So how can you get involved? Well, become familiar with the online program. Again, the link, we'll send out all the handouts and the resources, and you'll have access to the online program. This will never go away. Partner with community organizations. If you want to host a workshop, we're finding a lot of times it's been good to go to the senior centers or go to the literacy councils, or go to the different school programs. Sometimes you have to bring the library programs out to them and then let them know about how valuable a resource you are and what computers you have available for them to use. You can bookmark Medline Plus on your website, on your browser, for them to have easy access to that for an online resource. Do a staff training now that you've seen this, and with the resources Brittany will be talking about after, I think you'll be well equipped with some training for staff. And then, of course, host a workshop if you can, again, at your library or outside of the library. And now I'm going to turn it over to Brittany.
All right, thank you so much, Caitlin. I have a few more slides to go through with you. And then, just a second. Oops, that did not work the way I wanted it to. There you go. Okay, and then we'll get into question and answer. And I have been nabbing your guys's your questions, so I will read them out loud. And then if you have any more questions, just throw them in the chat, and we'll address them in just a few minutes. So I wanted to just talk to you a little bit about a national initiative that the National Network of Libraries of Medicine has going on right now, and that's where the funding for this webinar is coming from, and some of these other opportunities that we'll be pushing out over the next few weeks. The national initiative is called NNLM, All of Us Community Engagement Network, and for the initiative, we've teamed up with the All of Us Research Program, or I will call them All of Us throughout the next few slides, to help raise awareness about the program and to improve access to trusted health information. So just a few things about the All of Us Research Program. It has been funded by the National Institutes of Health, and it is a program that aims to build one of the largest, most diverse data sets of its kind for health research, with 1 million or more volunteers nationwide signing up to share their health information over time. The program's mission is to accelerate health research and medical breakthroughs, enabling individualized prevention, treatment, and care for all people living in the United States. And its goal is to help researchers understand more about why people get sick or stay healthy. And by looking for patterns, researchers may learn more about what factors affect people's health. The program also aims to reflect the diversity of the United States through its participants. So all people living in the United States, not just citizens, will be eligible to participate, ensuring that the research performed using this data set will benefit all people living in the United States, especially those who are traditionally underrepresented in biomedical research. All of Us is based on the concept of precision medicine, a new approach to improving health, treating disease, and finding cures. Precision medicine acknowledges that each person is unique, our habits, our environments, and our biology, and that the intersection of these three factors greatly impacts our health. These unique variables also mean that a medical treatment that works for one person might not work for another. So rather than using a cookie cutter, one-size-fits-all approach, precision medicine aims to deliver the right treatment for the right person at the right time and to keep people healthy longer. So ultimately, precision medicine can produce accurate diagnosis, earlier detection, and better prevention strategies and treatment choices, and is a radical shift in how each of us can receive the best care possible based on our unique makeup. To reach their goal of reflecting the diversity of the United States through its participants, All of Us is partnering with national organizations, including the National Network of Libraries of Medicine, to engage communities that are traditionally underrepresented in biomedical research. This slide shows you those definitions that All of Us is using to define these populations. And through our partnerships with libraries, we also aim to reach all populations, but especially the populations listed here. So the goal of the NNLM All of Us Community Engagement Network is to help public libraries in supporting the health information needs of their users and to help provide an awareness of all of us by providing health information training for public library staff, funding and other resources to support health programming and activities, connections to NNLM members and other All of Us partners and their community. In addition, libraries who participate in the initiative will support All of Us engagement activities in their communities by leveraging their services such as reference and programming, technologies such as public access computers, and meeting spaces. We'd like to emphasize that while we will be rolling out many opportunities for our network members to engage in the program, our primary goal of this partnership is to support health literacy and access to health information and to help connect All of Us partners to libraries in their communities. As an important note, public library staff and other NNLM network members will not be asked to recruit for or represent All of Us anyway. And so now I'm going to get to a little bit why it's relevant to digital health literacy. You're probably wondering why I'm talking to you about this, but I want to talk to you about a few ways that you can get involved in this program. We have a lot of different engagement opportunities, and I'll put the website up in just a second, but I'm going to highlight a couple of them here. One of our major goals for the NNLM All of Us Community Engagement Network is to reach people on the other side of the digital divide by helping them gain the digital literacy skills needed to access and evaluate health information online, but also to participate in an online research program like All of Us. These next few statements are going to be a little bit repetitive, but I think it's important to reiterate why digital literacy is so important to health. A couple of statistics on the slide show that 35% of US adults have gone online to figure out a medical condition, and that the internet is a de facto second opinion and even first opinion for many people. Information is also the second most popular online search, but that's not as easy as it seems. The World Health Organization tells us that when you search for cancer, you get 575 million results, and if you search for diabetes, you get 200 million results. And that's an overwhelming amount of information to navigate. So libraries can play a crucial role in helping their patrons access and use quality health information by providing access to computers and high-speed internet, helping users develop the digital literacy skills needed to use the computer, example, how to use a mouse, how to navigate a browser, and also helping users develop the necessary skills to evaluate that online health information. So you can learn a little bit more about how we're partnering to support digital health literacy on the website listed above, but specifically, you can play a crucial role in supporting digital health literacy by providing access to computers, helping to develop those digital literacy skills, and then helping users develop the necessary skills to evaluate the information. So we are, there we go. So we have a few things coming up. We will be working with Caitlin over the next couple of months to take this webinar, a more detailed version of it, and the in-person training that she does, to create an on-demand course in the NNLM training system, so that way you have a place to go to learn how to offer digital literacy training around health. What's really nice about this course is that it will be something that you can access when you need it, and you can go through it and do deep dives on specific topics. But everything that she does for the training that she does in Wisconsin will be available for you to learn. So it'll be a more detailed and deeper dive into what we learned and went through today. That on-demand course will be coming, hopefully our targeted date is to make that live May 1st, 2020. In addition, we will be creating some downloadable curriculum materials in partnership with Caitlin for you to access on our website. So this will be a slide deck, some handouts like the ones that she showed you, and a curriculum guide. So that way, if you are interested in offering the same training that Caitlin offers in Wisconsin, you can, and you will have the materials and the guide to do so. We're also working with the Public Library Association to make those materials available on their digitallearn.org website. That will happen a little bit further down the road, but we're hoping to get the materials up for you to access on this website listed here by February 20th, which is Thursday, I believe. So definitely check back and grab those materials if you want to do something similar. It's also a great way if you already offer digital literacy classes that aren't geared towards health to take a look at some of these materials to see how you can infuse health topics into the classes that you already offer. In addition, we have some other resources that you'll be able to access on this website, including some online modules on specific topics on how to learn internet skills. So how to create an email address, how to keep your information safe, how to set a password, some things like that. And those will also be available on our website in the coming weeks. And then we're developing a free promotional toolkit for participating libraries to promote in-library digital literacy health events as well. So if you are doing digital literacy and you want to kind of maximize the word into your community and get the word out about these activities, we will have some materials for you to use as well. And finally, there we go. We are also, oops, I'm on the wrong page. We are also inviting you to partner with us to offer in-library digital literacy training to your community members, but also training that we can promote back to any participants in your community that are participating in the All of Us research program. So digital literacy training is a service that many libraries currently provide. So if you have a digital literacy event coming up, or if you are interested in using and planning some training utilizing a curriculum that we'll make available, and you would like to promote it to program participants, we will make a form. This will also be live on February 20th. We will put a form on our website that you can enter the information into, and we will promote it back to participants in your community to get the word out. So those are just some engagement opportunities that are coming up, ways that you can get involved in supporting digital literacy in your community. If you're interested in learning more about or moving past digital literacy training and engaging your community members on topics related to digital literacy for programming, another thing that we encourage you to consider is offering some citizen science programming. We have another partnership with SciStarter.org that we're pushing out some citizen science programs that might be a really great way for community members to practice their digital literacy skills that they're learning in your training, but while also contributing meaningful data to collaborative and open source research. So if you're interested, take a look at that website. We'll be pushing out some program kits also in the next coming months on citizen science. And finally, and unrelated, but I promised that I would do this, so I'm going to, we do also have a new consumer health community of practice coming online. The website is on the slide. So the goal here is to pilot a community of practice for consumer health professionals, for library workers who are interested in advancing access to quality consumer health information in their communities, and to help connect interested professionals to resources, to each other, and to engage them in important conversations. All of the resources and conversations on the Community of Practice website will be free to access and to participate in, and it's designed so that library professionals can participate as much or as little as they want, because we know you're all really busy. So we want this to be a place where you can come to when you need it. So if you want to learn more, take a look. But coming up, anyone will be attending the Public Libraries Association conference this next week in Nashville, Tennessee. We're taking advantage of the fact that there's going to be a lot of librarians getting together just to learn together and to kick off our community of practice. So to do this, we're hosting a workshop in Nashville, Tennessee on Tuesday, February 25th from 1:30 to 5 p.m. It will be in the Music City Center in downtown Nashville, and it's free to attend. So if you're going to be there for your PLA or if you're within driving distance, please consider coming. It's going to be really exciting. The workshop is going to be facilitated by Dieta Jones and Associates, a consulting organization focused on equity, diversity, inclusion, and workplace transformation. And workshop participants will learn about cultural humility and applying the concept personally and at work in the communities that they serve. So the workshop is free to attend, but there are only 100 spots. So if you're interested in signing up, please go to nnlm.gov/allofus/COP for more information. And then finally, if you are interested in any of the things that we have talked about in terms of digital literacy, community practice, the Community Engagement Network, you each have All of Us engagement coordinator based in your regional medical library, and their names and pictures are listed on the slide, and you can get their contact information if you go to the nnlm.gov/regions. And we will also have their contact information in the slide deck we send out to you. So I'm going to put up this slide really quickly so I don't forget. This webinar is available for 1.5 hours of MLA continuing education credit, and it also can go towards achieving your CHIS level 1, that's your consumer health information specialization. To do that, you need to just watch the webinar or the recording and then fill out the evaluation, and the evaluation will ask you if you're getting credit, and then that will help you to get that credit. And then you will need the code IMPACT20 to submit and get that credit. So if you have any questions about that, feel free to reach out to me and I will answer your questions. So that's all I have. I'm gonna leave, oh, and here's our contact information. But for the Q&A, I'm gonna go ahead and leave the MLA CE credits up so you guys can kind of write that information down if you want to. And we're gonna head into the Q&A session. So I'm gonna start out with some of the questions that were asked towards the beginning of the presentation. And the first one is, Caitlin, I'm not sure if you know this, I wasn't able to confirm it. The Medline Plus easy to read information, do you happen to know what reading level that's at?
I don't know the specific level that it's at, no.
Okay, that's okay. We know that the Medline Plus content is at an 8th grade reading level or below, but we're not sure if, so I would assume then that the easy to read content is also probably at an 8th grade reading level or below. Mm-hmm. Okay, so then the next question is, what pages on the CDC website do you recommend?
On the CDC, it really depends on what you're looking up. Like I've done a lot of research on health literacy, for example, and their online trainings that they do. So I recommend that. I guess I'm not, are they looking for a specific topic that they're like on digital health literacy or certain like just in general about different diagnoses?
So it sounds like it probably in general, they're looking maybe for some content from the CEC that maybe doesn't have a super high reading level. So just any thoughts about that?
I think, yeah, some of their content is in a higher reading level, but they are doing a good job of revising a lot of the materials. They do have easy to read materials as well, so you can look for those links. But I guess it's such a large website that I don't think they have that specific, like Medline Plus with that easy to read section, if that's what they're looking for.
That sounds good. And one other thought too is sometimes if there is a good health information resource on the CDC website, it's linked in Medline Plus. So sometimes going to Medline Plus in the first place might help link you to some additional resources on a topic. Mm-hmm. All right, so then the next question is, when talking to patients, would you just recommend staying away from .com websites in general?
I would definitely recommend going to the Medline Plus first as an all-around good website. But I would first ask them what websites they have used in the past, what they're comfortable with, because that too is a user preference, and maybe they love Medline Plus or they love WebMD or Healthline. So you really want to ask them first what they're familiar with and what they've used, engage it off of that. And then yes, definitely still recommend Medline Plus or mayoclinic.org as one of those. The .coms, some of them can be very misleading, and anyone can create a website. So some of them can have false information. So if they like a .com website, you can say healthline.com and WebMD do have reliable resources.
Great, thank you. Next question. When drafting health promotion materials for patients or users, what readability tools would you recommend using to verify the grade level of the content?
There are a lot out there. Well, you have one within, if you're using Microsoft Word, there is the Fleisch-Kincaid on your Microsoft Word, but additionally, you can do the readability online. I can send those resources out because there is a list. If you would like the readability tools that we use, I can send those out in the resource links.
That sounds good.
Yeah, that way they have the direct links.
And then did you have any thoughts about, the rest of the comment was, it seems like there are mixed feelings about the reliability of some of these tools, notably the Fleisch-Kincaid. Any thoughts or comments about that, what we should be using?
Yeah, that one is hard because it doesn't look at the content into depth. It's more, it's not as specific as some of the other readability tools out there. Okay. I will follow up with a document that we have on readability tools if the participants would like that, to have a more confirmed resource list.
Yeah, that sounds great. Thank you. Okay, the next question is, what was the dropout rate compared to the number of patrons who started the program?
Dropout rate so there really was no dropout rate, I guess you would say, for the workshops. I'm assuming they're talking about the 32 workshops that we did throughout Wisconsin.
I think so. Yes, the workshops.
Yes, yeah. Workshops. Yes, so we had no dropouts. There was we didn't always get a pre and post survey from everyone. So that's where some of the numbers differentiated. Total reach though, let's see here, pulling up my report. The total project reach itself was 566 people, but that included 336 participants. Again, based off, there was only the 292 that had the survey results, so there's that differentiation in that. But then we had an additional 230 professionals from webinars and 2 national conferences that we spoke to about this. So, but we didn't do the pre and post surveys for that. So if you're looking for total project reach, that's 566 people, but the total workshop participation was 336 participants.
All right, next question. I know from Dr. Google that your training is only in Wisconsin. When you provide the information from this, will you share the outline of what is presented in the training so it can be offered in other states? And hopefully the curriculum materials will be something that you can use, so that way you can offer this training. Caitlin, did you have any other comments?
Yeah, no, we plan on doing that as well as a script so that you can have more of the verbatim, the verbiage that you like to use during the workshop. So there'll definitely be resources out there, as well as the online course that is being created.
Great. Yes, we're really excited about the course and the curriculum materials. It's going to be hopefully great resources for you guys to use. And then, is there a difference between Expert Partner and Speakers Bureau with the NNLM? The Speakers Bureau yes, there is a difference. So the Expert Partner is for a different part of the program. Yeah. So sorry, the Speakers Bureau is what you're looking at if you're interested. Is another resource we have. We're working on populating it. It's a database that will list experts on consumer health and consumer health information topics that libraries can reach out to and contact to be speakers for events in their libraries. So the Speakers Bureau is if you're interested in participating in that is what that is. And the Expert Partner, I think, is a different project. So I think what you're hoping to look at is the Speakers Bureau. And then, how do we locate the checklist you mentioned to evaluate websites? Those handouts should be available on the website by February 20th.
Yes.
Yes, and then will the All of Us program be available in Texas soon? Christy, that's a great question. If you take a look at the joinallofus.org/NLM, you should be able to see what locations they're active in, and I know that they are doing some enrollment in places like Houston. I wouldn't be able to tell you specifically where in Texas. So it is 2:30, so if you have any other questions, I'd be happy to stay on for a few more minutes afterwards. You have Caitlin's contact information if you're interested in learning more about NNLM resources, about the webinar. There's my contact information. I will be the one who emails out the recording, the chat, and the slides for you in about 7 days. Yeah, and Caitlin, thank you so much for agreeing to do this. This was wonderful, and I learned a ton. I took a ton of notes, so I think
awesome. Thank you. Thank you all in the All of Us program for putting this together.
No problem. Thank you. Thanks, everyone.
Thanks for watching. This video was produced by the National Network of Libraries of Medicine. Select the circular channel icon to subscribe to our channel. Select a video thumbnail to watch another video from the channel.